Good afternoon and welcome to Seminole County's press conference here today to talk about the COVID-19 impact and crisis upon our community. I want to welcome those who have tuned in as well as the news media who are here today to help us get the message out. I know everybody's been watching the news media across the country and wondering what's happening, what's going on, and where the certainty or light at the end of the tunnel is. And of course, I think all of us are in that same boat. As I've said on numerous occasions, these are waters yet to be navigated. And here in Seminole County, we continue to rely upon our medical experts as well as all the other experts who are weighing in both locally, regionally, at a state level and federal level to find out and understand our next best moves and when those are properly timed, et cetera, et cetera. Also want to assure that we are at the county, things are getting done. We've been able to, with some of these things that have occurred with traffic reductions, we've made several improvements to infrastructure that were already being done and already taking place, that we've been able to fast track some of those. Some of those are at the Lake Mary intersections of 1792. We also are doing some of those at Lake Howell High School, is 90% complete at the entrance. Sidewalk projects are also underway in East Altamont. We also have another project in Raven Avenue that will begin in May. All these are projects that we will continue to take place, and our public service people will continue to be engaged. We also have 5 Points entrance to the county center that's about halfway complete and continues to be constructed. And we've got so many more that we're now looking at, these essential workers in construction, continuing to be able to fast track some of these projects. On another note, our administration team has developed procedures to be able to continue our Board of County Commission meetings. We will have one tomorrow. It will be virtually. We have done a couple of test runs and we feel comfortable that we'll be able to get this done in a reasonable fashion. We also would ask that if you would like to call in, if you have a comment on those agenda items, you can go to seminolecountyfl.gov/meetings and follow the directions there on the website, and you'll be queued into a virtual waiting room with your phone call, and you'll be queued in as we're able to bring you on board and have your comments heard. With that said, we would ask you to be patient. This is the first time that we've attempted this. Many other municipalities around the state have done so, and we're looking forward to getting our way through this so we know where we're headed in the near future. I also want to welcome Chief Otto Droz, who is our new fire chief, who has started here at Seminole County. Chief Droz comes from Orange County with many, many years of experience. He will be here at one of the upcoming press conferences. He's hit the ground with his feet running with a great deal of experience in working with all of our first responders as well. I also want to thank all the staff, not only here at the Emergency Operations Center, but those at the county as well who continue either remotely working or working in the building to be able to provide necessary services to our community. One thing that we've been struggling with that many municipalities have is housing assistance for those who have lost their jobs, those who find themselves for the first time in their entire career or life, a need for some kind of housing. Just before I arrived, we received a letter from HUD that under the COVID package that was passed in Washington, Seminole County has been awarded just a little bit more than $500,000 in additional funding to help with those needs in the community. So that'll be getting geared up through our community services people to get out and help some of these individuals. I would also remind the business owners and those who are also looking for questions, this has impacted our community on so many fronts. It's not just a healthcare crisis, it's also an economic crisis. Many of the small businesses have been severely impacted. We continue to hear stories about the inability to contact, to receive some of these federal funds and grants. The Paycheck Protection Plan is one of those, a program. The bridge loans, I would ask that you be patient. We're constantly talking to the officials, not only at a state level, but at the federal level on ensuring the urgency of fulfilling some of these. It's uncertain whether there's going to be enough funds. There's been a lot of discussion there that maybe there's going to have to be more funds come in. But I would ask you in the community, try to use takeout services or patronize some of these smaller businesses that are operating in a limited fashion to allow them to to get back up to speed once the economy and this crisis starts to come to an end. With that said, we're also going to be joined today by Donna Walsh, our health officer here in the local health department. We also got Latrice Stewart of True Health that's going to be talking a little bit today about what's going on from their perspective here in the community. And of course, we've got Sheriff Dennis Lemma here, who's our head law enforcement officer that is doing yeoman's work in the community, not only to make sure that we all stay safe, but at the end of last week, I reached out to our tax collector. I asked for a list of contact information for food providers and restaurants to see if we could gather foods for those who are needy. We have some small businesses who have stepped up to the plate to offer the capability to cook those meals and provide those meals as well to the charities to help get more people fed. We're going to continue to see this. So I thank the Sheriff's Office for helping accommodate that. I think our small business people out there who themselves are hurting, but are giving back as much as they can to the community. So that speaks a lot. You know, during this time of uncertainty and unrest, there's a lot of people suffering, and this brings out the best in our community. And there's no doubt in my mind that Seminole County will come out of this stronger than we were before we entered that. With that said, I'm going to welcome Alan Harris, who's going to give you an update on what's going on as far as our emergency management. Thank you, Alan.
Thank you. Thank you, Chairman. The Emergency Operations Center, of course, has been staffed 7 days a week since the first case was identified, and we are continuing that operation. Our Citizens Information Hotline has continued to receive an incredible amount of calls, mostly during the week, not as much over the weekend, but we're going to continue the operation because we know that questions don't stop over the weekend. So our operational hours are still 8 a.m. to 5 p.m., 7 days a week, there for the Citizens Information Hotline. It is staffed by Florida Department of Health and Emergency Management personnel. That telephone number is 407-665-0000. Again, 407-665-0000. And of course, our website is updated continuously throughout the day, 7 days a week, at prepareseminole.org. For the number of cases in the county, I know that Donna's going to talk a little bit more about this, but right now, 269 confirmed cases in Seminole County. 163 of those have completed, so that means 103 individuals confirmed are isolated inside of their home. 301 individuals totally are isolated in their homes. That includes other people that are quarantining in their homes or isolating in their homes because they may have come in contact with someone with COVID-19. And of course, unfortunately, we had to notify the community of the 2 deceased individuals just last week, and our hearts go out to the family and friends of those individuals. We continue to help individuals that are isolated and quarantined, and we have at this point been able to house some individuals that are homeless or precariously housed. I know there's been some questions about those individuals. How would they be taken care of? So we have taken care of those individuals. We had already established a contract for a retreat in another location to house individuals that were homeless or precariously housed. If they came down with COVID-19, they were being released from the hospital, they were identified through going through a testing site, and being able to house them so that they didn't of course, help to further the COVID-19 around the community. So we certainly wanted to help them by helping us, of course, prevent the spread of this through the community. So we've been able to house some of those individuals. We, over the last 3 weeks, have delivered over 250 cases of food. A case of food will feed a family of 4 for about a week. And we also have now provided some pet care services to individuals that are isolated and quarantined in their homes. That includes for some couples that are now stuck in their hospital, taking care of the animals over at our animal shelter until they are able to get out of the hospital, or to actually sending vet and vet techs out to homes so that the individuals don't have to break isolation and quarantine to go to a veterinarian. So we've been able to help them with that. Us, along with the Florida Department of Health, have been able to provide a lot of medications and things like that, also to individuals isolating and quarantining inside of their home. So lots of services so people do not have to leave their home. We want to make sure that those that are being told to stay in their home by doctors, hospitals, Florida Department of Health individuals, that have COVID-19 that they stay inside their home, that they don't break isolation and quarantine, and they help us help the community stop the spread of COVID-19. Over the weekend, I'm very happy to report that we received 2 semis, over 12 pallets of personal protective equipment. That personal protective equipment has gone to assisted living facilities, nursing homes, and hospitals. Some had a relatively critical need, so we are very, very happy to provide those services to our healthcare workers, those on the front line of this battle, and we are very, very happy to receive those commodities from the state of Florida and the federal government. Today, further materials are being delivered to hospitals, assisted living facilities, and nursing homes. And a team from the state of Florida is going out and helping to train individuals on personal protective equipment in specific ALFs, assisted living facilities, and nursing homes. In the region, of course, we've had a drive-through test site at the Orange County Convention Center. We're working very closely with Orange County, Osceola County, the state of Florida, and the federal government for that regional test site. And we're very happy to hear that the federal government and the state government that's running that site has opened up the criteria. So now the drive-through site has 400 tests a day, which is a lot more than they did initially when they set out. You do not have to have a fever now to be tested, so you can just go down to the Orange County Convention Center and you do not have to have a fever to go through the line and get tested, which is an amazing accomplishment that they've been able to do over the last day. So this is new information that's coming out. If you've been in contact with someone with COVID-19, so you don't have to even have a cough and flu. If you've been in contact with someone with COVID-19, you can also go through this regional test site. And of course, medical providers and first responders have always been allowed to go through this test site, and they are still allowed to go through this test site without symptoms or with symptoms. Of course, they would be allowed to go. We are looking at a couple test site locations here in Seminole County, and we hope to have those sites available in the next week to 2. We are working with some labs and some individual organizations that may be able to establish those, still working through some of the logistics for something like that. What we have seen over the last week or 2 is that social distancing is working. The social distancing order that we placed before any other type of social distancing order in the state of Florida is starting to work. We are starting to see a slight curve, which is good. It means that people are social distancing in our community. People are being mindful of large groups and large gatherings, and we're starting to see the community spread slower just a little bit. I don't want to put too much out there, but it does look like that from the numbers. So it's positive, but we need to keep moving in this direction. To help with that, the public information team did an amazing job of developing these stickers that businesses can place on the floor. And so far, we've delivered over 60 businesses have received these stickers, and we are very happy to provide those to businesses. So if you would like one of these, or a few of these, of course, just certainly contact our office, and we'd be happy to provide that to the business. The last thing I want to talk about is face masks. And I know a couple counties and some cities have required the use of face masks for all members of their community when they leave their home. Seminole County highly recommends that you use face masks. We believe that's very important. We believe that will help to protect our community. We have no intention of requiring it. We're signing an executive order to require it, but we highly recommend it. So we would strongly encourage individuals to wear some type of face mask that is recommended by the Center for Disease Control and the White House medical team. If you, and we hope that you will, wear face masks, please wear them appropriately. And I will just say this a quick story. I was at the grocery store on Saturday to pick up a few items, and the face masks by 50% of the people were being worn around the mouth, but the nose was exposed. So we want to make sure that we cover the nose and the mouth. And I know that seems logical, but to 50% of the people that were in that store that day, it wasn't. So please protect your nose and your mouth. The face shield should be over both to protect you and the community. So we highly recommend that for our community. Right now we have no intention of making it a requirement or a law. And with that, I'd like to turn it over to Donna Walsh, the health officer for the Florida Department of Health.
Thank you so much, Alan. I may be repeating some of the information that Alan just presented. Just to let you know that Florida currently, as of this morning, is reporting 20,601 positive cases and 470 deaths. As Alan mentioned, in Seminole County, we do have 269 total confirmed. That includes 2 from Volusia County who are staying with us right now. And we have tested over 3,200 individuals in our county. As Alan mentioned, we're looking at mass testing sites, which could increase the number of positive tests that we have. In reference to flattening the curve, I just want to mention some latest data for you. From March 30th to April 6th is the last time that we doubled our cases. From 100 cases to 201 cases, about 7 days or 1 week it took us in our county to double cases. From April 6th to today, we've only gone up 25% from the last time that we saw a doubling in cases, so 267 cases this morning. So as Alan mentioned, we are definitely seeing evidence of flattening the curve, and that's due to the social distancing that everyone in our community is practicing. It's all that you are doing to keep others safe and to prevent those in our community from contracting the illness and also to save lives. As Alan mentioned, it's very, I report with a heavy heart that we've had 2 community members that have passed away from this illness, and our hopes are that, you know, through your vigilance, that we will continue to save other lives in our community. The other thing that's very important to remember is all of us coming together to address those social services that are available. As we ask people to isolate and quarantine, we completely understand that it's difficult for folks to get food and medication, and without the county support, we would not be able to provide. And so we're very grateful to the county and community partners such as True Health, and you will hear from Latrice Stewart, the CEO, in a few moments on what they're doing to help us with the underserved and underinsured, which I have mentioned in the past several times. Just a moment, I'd like to talk a little bit about the different types of tests. You've heard on the media that there is the Rt-Pcr test. This is a test that's been widely used across the nation and globally to detect acute cases of COVID-19 virus in individuals. There are some tests out there, the 45-minute test, the 5-minute test. These are all Rt-Pcr tests to detect acute infection. There's also a test that should become available in our state soon, an antibody test. And the benefits of an antibody test is that we then can detect if persons in our community have been infected but may have mild symptoms or no symptoms at all. So in other words, the burden of disease in our community, and whether or not those folks perhaps will be immune to any exposure to COVID-19. As we learn more about this virus, you know, more information is coming forward from researchers and scientists. But as we know today, it appears that those who have been infected may develop some, if not entire, immunity if they were exposed again. So there's more information out on that. We would like to, at some point, be able to provide the antibody test in our community, but please understand that that's not to diagnose you if you have acute symptoms. That's just simply to detect whether or not you've ever been exposed or had the infection in the past. So with that being said, I know Alan mentioned the Seminole County Citizens Information Line, 407-665-0000, and the Florida Department of Health also has a call center for any health department related questions. Certainly we'll take questions from the community at large, whether it's social services, and direct those accordingly. But we can be reached at 407-665-3000. And the state call center is open 24 hours a day for anybody who has questions, and that's 1-866-779-6121. Again, I would like to thank our community, our entire community, and all of our partners for all the work that you're doing to keep this virus from spreading, you know, throughout our community and protecting our most vulnerable population. We are going out with the Agency for Healthcare Administration on any cases that are reported in nursing homes, long-term care facilities, and we're also, as Alan did mention, a regional team is working with us very closely to also do co-inspections of those facilities, because as we still see from the studies, those elderly populations and those with underlying health conditions are still our most vulnerable. Does not mean that anybody else cannot contract the illness. we just see that those particular populations are most vulnerable to the complications of this virus. So thank you again for all that you're doing, and please continue to be vigilant. With that, I would like to introduce Latrice Stewart.
Good afternoon, everyone. My name is Latrice Stewart, and I am the CEO for True Health. I will be providing a brief update of True Health's response to COVID-19. As a federally qualified health center, we are here to serve the community and the uninsured as well as the underinsured. And so we will remain open and accessible to our patients and the community. We have worked closely with the Florida Association of Community Health Centers as well as local government officials to obtain COVID-19 testing, personal protective equipment, and guidance for our staff. And I'd like to stop and thank and recognize Seminole County for all of the help that they've assisted us with obtaining that equipment. Additionally, we have a strong partnership with the Department of Health, Seminole County, and are working collaboratively with the county's epidemiology division to meet the needs of the residents of Seminole County. Regarding COVID-19 testing and demographics, we are conducting COVID-19 and other related testing such as strep and flu at no cost to our patients. To date, we have conducted approximately 80 COVID-19 tests throughout our organization, and 65 of those tests were completed here in Seminole County, with 7 of them being positive. The 7 positive tests, the average age of those individuals was 37, and approximately 50% of those tests were from Caucasian individuals. We are starting outside testing for new and established patients at all of our True Health locations by appointment and walk-in only. Individuals must meet the screening criteria first, and then the test will be performed outside and within their vehicles. We're accessible to at all of our locations during our regular operating hours. We've launched telehealth services for all patients, whether you are new or established. We're also offering in-office appointments as well. We've started emergency-only dental appointments at our Castleberry, Lake Underhill, and Alafaya locations. For individuals who have lost their jobs, we have certified application counselors that are there to assist with enrollment into the marketplace, as well as for food assistance and enrollment into the Medicaid program. Our True Health pharmacies will begin curbside delivery for anyone who needs to pick up their medications to assist and help them to remain within their vehicles. We are also developing a plan to implement a prescription delivery program for individuals that are 65 and older, and the most vulnerable and at-risk population who have chronic diseases such as diabetes and asthma, to receive their medications at their front door. We continue to follow the CDC guidelines. We're screening all patients and staff before they enter into our locations, along with temperature checks. We have rigorous cleaning regimens for anyone throughout our facilities to keep everyone safe. We continue to social distance and allow our patients to remain in their vehicles when it's their appointment times. We have space intervals marked within each location. And I just want to add that if anyone requires testing or needs health services, please feel free to call us at 407-322-8645, or you can visit our website at www.mytruehealth.org. Thank you, Sheriff Lemma.
Thank you so much. And rounding out our final report, just kind of a state of where we're at with enforcement activities throughout the county. As you know and probably have heard, that the majority of what we're doing right now is educating people, making sure that they know what the CDC guidelines of best practices are. Since March 30th, there have only been 386 calls for service related to COVID-19. And that includes all the unincorporated Seminole County as well as the 7 municipalities. 142 of those calls were handled by the Sheriff's Office, and the remainder were handled by one of our partnering police departments throughout the county. As a result of those 386, 65 violations were noticed. The overwhelming majority of those violations were met with no documentation whatsoever, other than a verbal communication to promote compliance. The majority of those 65 were on the very front end of this at the beginning of the month, where people were still learning what the best practices were. During the first week of April, there were 2 written warnings issued, one by the Winter Springs Police Department for a car dealership, and another that was issued by the Altamont Springs Police Department for a hair salon that I've already spoken about at previous briefings. Again, those were written warnings. Up until now, no enforcement action has been taken against any citizen in Seminole County, in any of the cities or the unincorporated areas of the county. And I think that that's important to note because, you know, a well-informed society knows how to regulate themselves. As I go out and about, I see people wearing masks, I see people adhering to the CDC guidelines and recommendations, and we have not had any of those knuckleheads that we've seen on social media and across the nation of people who are spitting on oranges, coughing in individuals' faces. You know, if we do have a situation like that, we will deal with that with the full scope of the legal abilities. Since the Florida stay-at-home order was issued on April 3rd at midnight, we've had a combined 28 calls for service and then 4 noted violations out of the 28, which tells us that a majority of the people that are calling in and alleging that somebody is violating either a stay-at-home ordinance, an overwhelming number of those, there is no violation going on at all. A little bit about the crime for what it's worth, and we've seen this trend from the beginning of this incident, and I think that it holds true probably for most jurisdictions across the country. There's a downward trend, a month-to-month comparison of Part 1 crimes, which is index crimes, the most significant 7 categories of crime: the murder, rape, robbery, ag assault, motor vehicle theft, larceny, parts and no parts from vehicles, has reduced a 12% month-to-month comparison from last month to this month, but when compared to the same time frame in 2019, a 38% reduction. And that kind of holds true from the beginning of this. We were talking about a 40% reduction when you compare the situations going on now to the situations that were occurring at this time last year. Our Department of Corrections is also continuing to decrease their bookings. They're down by 38%. And again, that's obviously direct filing on some misdemeanor violations that have occurred where the people don't actually need to be taken into jail. Again, they're not getting away with crime. They're just having those charges filed on them as opposed to the physical arrest and being brought into the facility. I've spoken about this before, is the last thing we want is to contaminate the inside of the facility, not only for staff, but for the inmates that are there. We have a responsibility to do that. But largely that reduction in numbers is because when commerce slows down, when there's less people on the roads, there's less of an opportunity to get involved in more traditional criminal acts. So we see that, that trend continuing. I will tell you that if you are a bad guy out there looking at this as an opportunity to take advantage, we have a lot of law enforcement officers right now who are not as busy as they normally would be, and they will focus on you, and they will conduct these investigations. They will take the people that need to go to jail. Nothing has slowed that process at all. And actually, we're making some very, very good cases right now with the additional resources that are out there. We're looking for those people who capitalize and prey on the vulnerable. I think it's important to note that this week marks the beginning of Telecommunications Professionals Week. And I think that they are the unsung heroes when it comes to the law enforcement side of what we do. Here in Seminole County alone, there's about 150 public safety dispatchers and communications professionals that are at the grind day in and day out. And even with the reduced amount of calls coming in, they still handle approximately 65,000 calls for service per month. And many of these individuals are right there with the deputies and the police officers, and they're given great communication and sometimes life or death scenarios when it comes to CPR and other critical things that are going on. So I want to send a special thank you out to them, those unsung heroes that are in the trenches behind the scene day in and day out. We could not do any of this without you. and not just the ones here in Seminole County, but across the nation that are doing that every single day. I talked about a couple of focal points now because in law enforcement we're already thinking about the aftermath after this. We understand that this has been devastating to commerce and our local businesses, which tends to lead to more use of controlled substances, more arrests. I think the saying is sometimes people will beg, borrow, and steal. Sometimes that is quite literally what happens. So it's important that we make sure that the proper resources are available to people who are going through mental and physical consequences as a result of their individual unique situation. The suicide is up about 40%, and that percentage number is a little misleading. It went up from 3 to 5. We had 2 in one day, but that trend is something that we need to look at very, very closely. It's actually 67% from 3 to 5. But we want people to know that there are services that are available to them here at the Sheriff's Office or national services. The National Suicide Prevention Hotline is 1-800-273-8255. And you can report, you can talk to somebody, you can remain anonymous. We want you to know that there are folks here locally or at a national level that will help you get through whatever you have going on. Also, with this situation, we see overdoses. Those don't come to arrest, so those people who are opioid use dependent, we want to make sure that those services that we have to offer here are also made available to you as well. I think our community is using good common sense. They're listening to the tips and the information, and what's great about social media now is people can play this back from the beginning. If they miss the initial report of the broadcast, people will come in halfway and say, what's going on? Watch this. I mean, we're here for about 30 minutes today alone, talking about all the things that we're doing. You can kind of look at that. And again, stay safe and stay at home. Stay at home as often as you can, and I think that is boding well, not only for us here, but across the country as well. And last and certainly not least, I want to thank those healthcare professionals. You know, I read the stories and I watch the videos of them donning this equipment and going in there and caring for the most vulnerable. And I want them to know that us in law enforcement and the uniform-wearing members of public safety are so proud of the work that they're doing and the difference that they're making in our communities. Thank you.
Thank you, Sheriff, for the update. Thank everybody who's here today on behalf of the county and the citizens of the county. And I think the underlying scenario that we're hearing is, you know, we truly are blessed here in Seminole County that our residents have been heeding the advice, been doing what's right, staying home as much as they can, working from home. You know, this truly is a crisis that we've yet to see completely play out. We've heard good news today that we appear to be turning the curve or flattening the curve the right direction, but we continue to monitor that and be cautious and vigilant on where that ultimately ends up. I know there's a lot of business people, a lot of employees, you know, really worried about where their next paycheck is coming from, and then it is the next meal that comes from. I will tell you, there are a lot of unsung heroes in this community, from the healthcare workers to our first responders to business people to the charities, who are really all working together. And day by day, we see some new event that occurs. We see some random gift of kindness from one resident to another or to a charity. And it really and truly is what America is all about and our community is all about, which is coming together, not physically, but coming together to help those in need. As we see this unfold, we see more of that. And hopefully we continue to work together on all fronts to mitigate these damages, not only from a personal level, but also from an economic level and perspective as that begins to unfold even more. With that said, if you are out there and you have questions or needs, whether you are an individual who has needs for meals, lodging, or anything else that you have a question about, if you're a small business that you can't get through or don't understand some of the SBA issues that are out there, all those resources are on our website at prepareseminole.org. And also feel free to reach out to our Citizens Hotline at 407-665-0000. And finally, Although we want you to stay at home and be safe, if you need to get out, our trails and parks remain open. I'm happy to report we have just finished all of our trail markers with wayfinding, with lat lawn numbers, so that if you have a need while you're out there in some of our more remote trails, you'll be able to get help with a call to 911. So with that, I'll turn it over for any questions that you all may have.
Over here. I have a question for Ms. Walsh.
Ms. Walsh? And if you don't mind, repeat the questions, but the listeners can't hear the questions.
Okay. So last week, we were told that there was a 60% ventilator availability in Seminole County. Do we have an update on that for this week?
We do. I don't have those numbers before me. We're at 75% availability? Okay. Those are reported out daily, though. Is it daily, Alan, or daily reports? Yes.
And what are the demographics of the 2 COVID-19 cases that were deadly? Do we have the age or any information on these people?
That information, they are elderly. We have a 91-year-old was the first, and a 68-year-old, the other, both with underlying health conditions.
Alan, real quick. Good. So both you and Donna were talking about the fact that we're flattening the curve, Jay did as well.
Sure.
If I'm doing my math right, so for like 2 weeks ago, in a week, we went up 100%, it doubled. Right. Then the last week, it only went 25%. Right. People are gonna rejoice, throw their hands in the air and say, when can I start, having a party at my house? Right. The message.
So the message is we have to continue to social distance. The message is that this is a brand new virus and we don't know a lot about it. This is, we upstairs in the EOC, we've been saying we have to keep the pedal on the gas right now. We need to not immediately go back to the way it was, because we've seen what that looks like in other states. So we are already discussing plans on what that would look like. In Seminole County, we never closed any businesses down. I mean, we did initiate a social distancing order, which in some ways prevented some businesses from operating fully, but they could still operate. They could still sell products and things like that. So as a policy group, we're discussing how would we, if the governor was to relinquish the order, we would still maintain some type of social distancing. That's still the guidance of CDC. That's still the guidance of the World Health Organization, the White House medical team. That's continuously been the guidance. We don't want people to go out and immediately think it's gone, because that would, we've been talking a lot, and you're going to hear, and you probably already have heard, the second wave. The second wave. There's been this discussion about the second wave. Well, the second wave can be prevented if people do what we're doing right now. There are safe ways to do it. So, and that's something that all leaders across the entire nation are trying to figure out. What's that going to look like? So.
To put a fine point on it, I think what I'm hearing you say is, just because proper behavior is working doesn't mean we should stop the proper behavior.
That's correct. So we need to continue to do the things that are working. And if we're able to soften a little bit and open some businesses up, that would be fantastic. But those businesses have to continue to do the social distancing that's helping us to prevent the spread of the COVID-19.
To piggyback off of that, with Easter happening this past weekend, do we expect another rise in cases in the next week or so?
I can say in Seminole County, I only heard of, and I'm looking at the sheriff to see if he heard of any, I only heard of 2 churches holding in sanctuary services, and they weren't that large. Most all of them were, other than that, and I just heard about them, other than that, most everything was online services. I can speak for my church. My church was online service, and it was one of the most beautiful services I've been to. It was just amazing to see people commenting back and forth online, and I know other people had that experience with their own church. I know there were some drive-in churches, which we allowed here in the county. I know in some other parts of the country they weren't allowed to do that, but here we believed that did meet our social distancing order, that did meet the tenets of the executive order from the governor. So there were some drive-in churches. All of those were very, very safe.
Alan, we've heard about more frequently about Orange County's mass testing site. Daytona has their mass testing site. There's nothing really mass here in Seminole County. But what are the options for people so that they don't have to drive all the way to Volusia or
Sure.
Orange County?
So the Orange County testing site is not Orange County testing site. And I think that's really important for us to understand as a community. It is the Metro Orlando. It is a regional testing site. The federal government came in to service Seminole, Orange, Osceola, Lake, Brevard counties, because that's where the Metro Orlando area is. They had to identify a large enough parking lot to do it that was empty at that time. The convention center had just lost all the conventions at that particular time, unfortunately, so that seemed to be the proper location to do it. Lots of parking, lots of areas for movement, things like that. So that testing site is a regional testing site. Obviously, it's very, very hard for the folks in Daytona to drive all the way down to the convention center, so they, upon themselves, looked at having their own testing site. We are looking at a couple locations for a testing site. We hope to have one by the end of the week open up in the Sanford area, and then we hope to have one open in about a week and a half in the Altamont area. It's not going to be the size of the Orange County Convention Center doing 400 tests a day, because that has all the assets of the federal government, state, National Guard. There's just no way there's no way all 67 counties could have something like that in Orange County, at the Orange County Convention Center. There's only 5 of those across the entire state of Florida. There's one at the Jaguar Stadium in Jacksonville. There's one at Hillsborough. There's one here that services Pinellas County, Pasco County, and all the counties surrounding Tampa. There's the one in Fort Lauderdale, the one in Miami. So they were only able to do a few.
Alan, True Health is also testing.
Oh yes, so there are other. I mean, we have 23 test sites here in the county, and of that, there are places where you can go to get quote-unquote drive-up tests. So you just heard from True Health where you can call in and make an appointment. Very close to our borders, there's another location that you can go, and that is UCF. So UCF as well. So the UCF testing site, you need to make an appointment, just like with True Health. You need to make an appointment. True Health is allowing some walk-ins, but make an appointment for the one at UCF. You need to have your medical insurance, or there's a fee. For True Health, it's, and I don't want to talk for them, but I'm hearing it, I'm seeing it. It's free. It's for the underinsured and no insurance. So that's primarily the focus. Come on up and yeah, you can answer a little bit more about that. I don't want to answer things for you. Thanks.
We are offering appointments and walk-up tests, and they're for everyone, whether you're uninsured, underinsured, or you have insurance.
How many tests can you do a day, I guess?
So currently, right now, we have about 120 tests company-wide, but we're expecting some more tests to be delivered to us within the next few days.
Are you finding that the tests are still hard to get?
I think that that's just an issue nationwide, to be honest with you, but we are working with a lot of state and local officials to receive tests.
And so when somebody pulls up, like we were out at the health department building, they walk up to the tent and then you have them drive around to the side, sort of just walk through the process?
That's correct. That is correct. And we start a screening process when they drive around to the side, and then our providers will come out and administer the test.
One more quick question, Alan, just an observation that one of my colleagues saw this weekend. He happened to drive by a cemetery in Sanford, and there was a funeral going on. And it was a very large gathering of people very, very close together. Your thoughts on that? I mean, you know, it's always that delicate balance. I mean, you have people who want to grieve when their last opportunity to grieve, yet clearly the crowd was of a certain size and a certain proximity that didn't look appropriate for what we're going through.
Right. So this is something that we've had to battle, of course, unfortunately. And battle, I mean battle internally. So how do we push a message that says you shouldn't have a wedding at this time with large groups of people, you shouldn't have a funeral service with large groups of people, but also allowing individuals to mourn or celebrate if it's a marriage, or a place of assembly. So that's been a challenge for us internally, but in the county, and we've been saying that 10 or less people, 6 feet apart. So I know a lot of funeral homes have contacted us. Well, how can we do this? And they have found very unique ways of doing it through multimedia, lots of different methods for doing this. Most of the funeral homes have, I've never heard of a funeral home not complying since the order was issued. It would be news to me if there was one here in Seminole County. I just haven't heard of it. We haven't had any complaints. I'm looking at the sheriff, but we haven't had any complaints about large funeral services or anything like that. Most of them are following and this is a recommendation again from the CDC, World Health Organization, and the White House medical team. So 3 completely separate medical professional groups that are getting together and saying you should not be in groups of 10 or more, and you should be 6 feet apart.
Sheriff, I want to ask you a quick question about the suicide rate. Is it worrying that because so many people are out of work, they're depressed, that we're going to see more of these kind of cases pop up? Is that something that you're worried about?
Yeah, I mean, the question is whether or not we're going to see more suicides, throughout the community, and the answer is I don't know. I know when it comes to suicide and these other underlying conditions that are present, it leads people down that path more frequently than ever. And I do recognize that some people have their entire life savings tied up into their employment, and there is so many unknowns right now. So what we want to do is to make sure that people who normally would not need services or really not pay attention when services are offered, it's something that say, well, that's somebody for somebody else, are now finding themselves in a critical time. We had 2 suicides in one day. It could absolutely be nothing more than a coincidence. But I would tell you, we're looking at the numbers very closely, and we want to make sure that the public knows that there are services that are available out there in the event that they need it, not only for themselves, but for a family member. As things are slowing down, these offices are closing. This is one of the things that we have plenty of time and plenty of resources working with the county and other folks to get there. And if I could just comment on Dave's comment about the funeral and all that. I mean, if we were dispatched there, we wouldn't really do anything about that anyway. All of these rules are intended to protect people. And, once they're there and they're gathered already, even going out there and trying to separate them, the damage would have been done already. And I think that we have to really evaluate these and use good emotional intelligence that people are grieving, people are doing that. So I'm hoping we can get through this without taking any action against any person. But some people are just not going to follow the rules, and they're going to do whatever they want to do,
Certainly wasn't the intent of my question that
Yeah.
it should be, to go out and be rating a funeral service, but there are people driving by there that are saying, when am I going to run into those people in the grocery store?
Yeah. And it's a legitimate concern, but what I do know is there is a certain percentage of our community and population that have been inundated with information about this, and they're not even watching these news conferences. They're not reading the paper. It's creating depressions and all that. So I think that's one of the things that we're finding right now is education, and awareness. And if you think Seminole County is the 3rd most densely populated county, 345 square miles with nearly 500,000 people here, to only have 28 calls and no violations. And as far as the church services, we had no violations at all. With Easter services, no complaints, nothing to follow up on whatsoever.
Sheriff, can you speak a little bit on the 2 boat ramps that reopened? Have you seen any issues or given out any tickets since they reopened? Any plans to reopen any more boat ramps?
That's a decision that the county has to make. It's their boat ramps, but I will tell you, we haven't had any problems on the waters, not at least on our side of the river. But we've increased enforcement with that. We have the ability to patrol a lot of the waterways by helicopter, just kind of looking out there, and we have had no calls for service since the beginning of this related to violations on our waterways. Not one.
Well, I want to thank everybody again for joining us today. Thank all the participants for helping us get the message out. We'll continue to do these press conferences and update you again. Go to our website for a lot of information. One thing that I want to assure everybody, we've talked about a little bit, we're working hand in hand with all 7 cities All the law enforcement folks are working together. Everybody through the entire county is really working and doing, you know, overtime work, working together to make sure that we're able to get through this as quick as possible. Again, with that said, we can't let off the accelerator. You've got to continue to do what's best for the community. And the more we do that, the quicker we can get through this. And one last point that was brought to my attention for some of you out there that aren't aware of it, call your automobile insurance companies. A lot of the insurance companies now are actually giving rebates or discounts in your monthly fees or your annual fees because we've seen a downtick in the usage of the automobile. So your premiums, many companies have decided to adjust those. So take advantage of that. With people being out of work, small businesses impacted, why not leverage anything and everything you can? Again, on behalf of the 7 cities and my fellow Board of Commissioners, thank you all for joining us today.